Welcome to another episode of What is Hashimoto's with Dr. Martin Rutherford. To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com. And now, here's Dr. Rutherford.
So today we're answering the question of, can Hashimoto's cause hyperthyroidism? Again, this is a lengthy kind of explanation. We're trying to keep these to smaller chunks and segments that don't take up part of your day, whole part of your day. And this is what I've been seeing a lot more of lately, and it seems to be very confusing in a sense that it used to be you had hypothyroidism or you had Graves' disease. Nobody even really looked for Hashimoto's, and then Hashimoto's came in just so I could screw up the whole picture because Hashimoto's is like hypothyroid. They call it Hashimoto's hypothyroiditis if it's inflamed, or Hashimoto's hypothyroid if it's not. Anyway, so it's hypothyroid, so you get the hypothyroid stuff, and then when you get the hyperthyroid symptoms, especially if you're the unusual Hashimoto's patient that is thin, that has all hyperthyroid symptoms, and has no hypothyroid symptoms, now it gets confusing. So the first go-to is, does this person have Graves' disease? There are different antibodies that you check for that. It's called thyroid stimulating antibodies, and if you have those, you have Graves' disease. But if you have those, you could also have positive antibodies for Hashimoto's. But Graves' disease, if that one marker comes up, you opt for Graves' disease, and then that's a medication to stop the too much hormone from going on, or they radiate it, or you take it out. Now, there's this big gray wasteland of hyperthyroidism. I'm hearing the diagnosis more and more. Basically, what is in the literature that causes hyperthyroidism are a few things. Okay, Graves being one of them. Toxic nodule. Now, so nodules. So you get nodules, and you test a person, and you feel for the nodules. And if you got one nodule, or if you got multinodules, if it's tender, for sure, you want to go get it checked to see if it's a cancerous proposition. Most of the time, it's not. Thyroid cancer isn't that common, but it happens. People get it. But these nodules, my understanding so far, and here's where I say this. I mean, you have to understand that we are in the evolution of understanding all of this stuff. That's why I do these things. Everybody comes in and they think like, oh, well, you should know all about the whole thing. Well, nobody knows all about the whole thing at this point in time. And toxic nodules are right up there. Nodules are right up there in the area of nobody knows everything about them right now. So what it appears right now is that you get a nodule, whether it's a toxic one nodule or whether it's a toxic multinodular, many nodules. Today, what's happening mostly is we're getting them ultrasounded, and then they go, okay, that's a nodule. Let's do a biopsy on it, and then we do the biopsy and look at them, and like 99.9% of the time, the biopsy comes up with abnormal cells, but not cancer. And so what seems to happen most of the time is that the doctors kind of want to hedge their bets that those abnormal cells don't become cancer, and then usually advise you to take it out or radiate it. But the reality is that, at least this is what we think the reality is at this point in time, is they're now moving towards the fact that most nodules and most of those abnormal tissues are secondary to Hashimoto's, and that so they become toxic because they're growing, they're getting inflamed. Chemicals will set them off. Food sensitivities will set them off. Viral infections will set them off, which I'm going to get to in a second. And so the next thing, you got a toxic goiter or a toxic nodule, and you're getting hyperthyroid symptoms every time you eat the food, or you start getting heart palpitations, anxiety, you start getting things of that nature. I just mentioned viral infections. So there's a cross here. Viral infections of the thyroid themselves can cause hypersymptoms. Viral infections in and of themselves can cause hyperthyroid symptoms. And a viral infection in and of itself, it can cause when you go through certain aspects of the viral cycle, can cause that thyroidish type of thing. But viruses can cause an infection in the thyroid. And indeed, this goes to the it's all Epstein-Barr virus thing, which it's not. For those of you who watch me, you'll know Epstein-Barr virus is one of 39 different different triggers for the for thyroid. And when it gets tender, when it gets like that, and it stays like that, and your doctor maybe still isn't quite up on Hashimoto's, you get changed, you get the heart palpitations, you get anxiety, the night sweats, the insomnia, the inward trembling, all of these things, and they don't check you for a thyroid, so they don't realize that you may have Hashimoto's, and that could be an infection, a viral infection. They pick up the viral infection, but they don't realize that the viral infection has gotten in your thyroid and is now perpetuating a hyperthyroid Hashimoto's type of a situation. Another one with Hashimoto's is over-medicating it. Over-medicating the thyroid can actually push it down into a very, very hyperthyroid area. Obviously, like, duh, I'm over-medicating it, and so there'll be too much thyroid medication in there, and mostly that's a hyperthyroid state. I don't know, that's not exactly what I'm sure the patient or the person who is asking this question is asking about. Excuse me. However, that is one thing that causes hyperthyroid. And another one is, excuse me. And another one is too much ingestion of iodine. And we've talked about iodine not being a proper supplementation for the Hashimoto's patient. If you are one of those unusual straight hypothyroid patients, iodine good. If you are a Hashimoto's patient, iodine bad. So just in case the person asking the question is suffering from hyperthyroidism as a diagnosis from the doctor, all the testing is normal. If you have Hashimoto's, let's say you have a multivitamin, it's got iodine in it, or you went to an alternative practitioner who's still in the 1960s and 70s and 80s or whatever, early 90s maybe, and they're still going, ooh, it's all about iodine, and no, it's iodine for the thyroid, and it's not iodine for the thyroid if you have Hashimoto's. So if you're doing that on a regular basis, you're not aware of it, and you have Hashimoto's, and maybe you're not even aware you have Hashimoto's. Maybe you haven't been diagnosed yet, and you're walking around with hyperthyroid state and nobody can figure out why. Then there's a good chance that it's the iodine that you're ingesting. And if that strikes you who are listening to this, like, wow, I take iodine, but I'm not Hashimoto's, my answer to you is go check yourself for Hashimoto's. Those are things that cause hyperthyroidism that are not Graves' disease, and that are either directly related to Hashimoto's or via the iodine, and the virus is indirectly related to that hyperthyroid diagnosis.
Thank you for joining us for another episode of What is Hashimoto's? To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com.